Hello everyone, Namaste. Today we will understand Ayurvedic perspective about diabetes. This is Dr. Mandar Bedekar. I am basically an academician and a clinician for last 25 plus years. Presently I am associated as Honorary Ayurveda consultant with the Freedom from Diabetes. We have planned to have a series of videos about Ayurvedic perspective about diabetes, and today this is the onset of the series. At the onset, let me clarify that Ayurveda has not mentioned diabetes, the same term diabetes, simply because Ayurveda has a huge history of 5000 plus years. The then mainstream language was Sanskrit, and obviously all the descriptions found in the Ayurvedic classical texts are in Sanskrit. So there is no way that diabetes as such will be found in any of the available Ayurvedic texts. But that doesn't mean that Ayurveda has no solution, no knowledge about diabetes. Let me clarify that Ayurveda has described in great details a disease called prameha, and if we study prameha, we can quickly arrive at a conclusion that prameha, some types of prameha to be precise, are most likely to be equated with diabetes. To be precise, diabetes mellitus according to the modern Western perspective. So in this introductory video, I'll be just elaborating the Ayurvedic perspective about prameha, which is parallel to the diabetes mellitus. Now why diabetes? Simply because the number of people affected with diabetes is increasing globally, and in India the number of diabetic people is increasing with a threatening speed. So there is a need to intervene, there is a need to inculcate all the possible wisdom, all the possible traditional knowledge, all the possible pathies, and then only we as a country can face diabetes. So let me clarify that unlike the modern Western medicine, which says that diabetes is sugar related disease, once upon a time you might be knowing diabetes was known as sugar diabetes, but Ayurveda has a totally different perspective. In Ayurvedic perspective, diabetes is a metabolic disorder manifested through abnormalities in urine. Mind you, Ayurveda doesn't speak about sugar or anything related to that. Ayurveda believes that there is a disease which generally manifests through abnormalities in the urine, and that's why the name prameha in Sanskrit. The causes of diabetes, if one knows the causative factors, one can avoid as far as possible the probable causes and can continue to be healthier. The causes of this disease in Ayurvedic perspective are, of course, excess indulgence in sweet food, excess indulgence in oily or fatty food, and excess indulgence in cold food. Let me clarify here that sweet in Ayurvedic perspective, it's not just sugar, not just the sugar which you put in your mouth, or not just cake and pastries and sweet drinks and whatnot. According to Ayurveda, even if you eat any product of a cereal, say wheat or rice for that matter, once you put it in mouth, you develop a particular feeling, and once it undergoes digestion, your body gets nourished out of it. So these kinds of actions together are believed to be a consequence of sweet quality. So according to Ayurveda, all such sweet items, if consumed in excess, can be a cause of diabetes. So excess wheat consumption, excess rice consumption, many other cereals and grains are included. Together they are called as causes for diabetes. To take it further, as everybody knows, excess and wrong consumption of milk and milk products. On Indian parameters, I must mind you about excess and wrong consumption of curd, dahi in Indian languages. And when it comes to Europe and Americas, wrong and excessive consumption of yogurt. These are the main causes which can induce diabetes or which can worsen already existing diabetes. Of course, there are a few more causative factors. As everyone knows, it could be hereditary. Sedentary lifestyle is another cause. But before I go to the next stage of explanation, let me tell you that Ayurveda has precisely says that complete lack of exercises, zero exercises, is one of the main causes of getting prameha, the diabetes. So with this initial knowledge about the causes of diabetes, prameha in Ayurveda, let us try to understand the difference in the perspectives. As already clarified, the modern Western science prefers to call it a sugar disease related to sugar, carbohydrate metabolism, pancreas and whatnot, which everyone knows. And that's why accordingly it is classified as type 1 diabetes, type 2, gestational diabetes, etc. When it comes to Ayurveda, as already clarified, Ayurveda considers it as a metabolic disorder manifested through the abnormalities in urine. So there has been a detailed classification of this disease, the prameha, and Ayurveda has successfully come up with a detailed description of 20 plus types of prameha diabetes. If you have at least some idea about the basics of Ayurveda, the Vata, Pitta and Kapha doshas, you would probably like to know that there are 4 types of prameha diabetes believed to be caused due to Vata problems. There are 6 types believed to be caused due to Pitta problems, and there are 10 types of prameha diabetes believed to be caused due to the Kapha dosha problems. So this is about the classification and difference from the modern Western medicine. One very interesting difference between the Ayurvedic wisdom and the other sciences is that Ayurveda had developed an art to predict the happening of a disease. A group of signs and symptoms, collectively called as Purva Rupa, you can say pre-disease signs and symptoms, used to be described in case of every disease in the past, a couple of millennia ago. In case of prameha also, Ayurveda has described pre-disease signs and symptoms, the Purva Rupas. Because it's just an introductory session, not an academic class, so I'll just indicate a few such pre-disease signals. For example, burning in the palms and soles of the feet, dryness in the throat are commonly known pre-disease signs and symptoms of prameha. But to extend this discussion, excessive sweating, which is called as profuse sweating, excess thirst and excess hunger, these 3 signals can also indicate a would-be diabetes, would-be prameha in near future. 2 more interesting signals, pre-disease signals of prameha diabetes are: if a person finds that in spite of cleaning the teeth, cleaning the tongue, etc., the person continues to have a sticky feeling, a person continues to have tartar on the teeth, plaque on the teeth in spite of cleaning, it is almost for sure a pre-disease signal of prameha diabetes. And lastly, if a person observes that his or her hair and nails are increasing with a greater speed compared to before, it could also indicate prameha in near future. As far as the signals of diabetes are concerned, I think there is no need, because the entire world now knows and anyone can find it anywhere. So on a concluding mode for this particular video, I would say that Ayurveda has a lot to offer about the management of the diabetes. Why? Because Ayurveda has studied how the disease proceeds, the journey of a disease from causative factors. Ayurveda has clarified that once a person continues to do the wrongs, the causative factors, the person's digestive fire, we call it Jataragni, the fire here in the tummy, gets impaired. If it is ignored, then the impaired digestive fire, for convenience you can call it low fire or low digestion, low appetite. The impaired digestive fire in turn disturbs the tissue fire within the body. Ayurveda believes there are 7 dhatus, 7 tissues, and the tissue metabolism also gets disturbed. As a result, one of the tissues, one of the dhatus called as Meta dhatu. In Indian colloquial language we can call it charbi in colloquial Hindi language. So the Meta dhatu, the charbi, gets impure, gets vitiated, and as a result there is excess of kleda. Kleda is a watery waste or watery derivative in Ayurvedic perspective. So as a result kleda starts increasing, and the increased kleda the body tries to throw out in the form of excess and abnormal urine. That is what prameha is, and that's why I repeat, prameha is believed to be manifested through abnormalities in urine and not just the sugar level of that particular person. Now if a person gets diabetes, if a person is diagnosed as having diabetes, how Ayurveda can manage it? This is the concluding mode. Of course, in videos to come I will be explaining different aspects of Ayurveda, but let me clarify that I am not here to make any tall claim or false claim. But for sure, Ayurveda is science of life, so it can offer a lot as far as health maintenance is concerned. As far as diabetes is concerned, Ayurveda can offer how to manage in pre-diabetic stage itself, so that the patient probably will not enter into a diabetic phase. If in case a patient is already diabetic, Ayurveda can offer many different modalities to be for controlling the diabetes. And if in case there are some abnormalities, some complications, some consequences of diabetes, Ayurveda has a lot to offer. For example, diabetic retinopathy, diabetic nephropathy, and diabetic neuropathy. Ayurveda can certainly offer a few remedial options to tackle these problems. The modes to tackle these problems either in pre-diabetic stage or in diabetic stage are, of course, diet adjustments, exercising, lifestyle changes, and if needed, use of herbs or use of home remedies. So in the videos to come, I will be explaining these points one by one, so that if at all someone is interested to prevent diabetes before it manifests fully, Ayurveda is certainly there to help him or her. So thanks for listening, stay tuned, and in the days to come we will be coming to you with more and more inputs from the great science Ayurveda. Thank you.